Before surgery or a medical procedure, midazolam 1 mg per milliliter injection solution is often administered. It is used to induce drowsiness, reduce anxiety, and diminish memory of the surgery or procedure. This medication can also assist with anesthesia or sedate individuals who require assistance with breathing using a tube or machine. Midazolam works by calming the brain and nerves, and it falls under the category of benzodiazepines. The daily dosage and optimal timing for taking midazolam should be determined by a healthcare professional based on individual needs and medical condition. When using midazolam 1 mg per milliliter injection solution, it is important to follow the instructions given by your doctor. This medication is typically administered slowly into a vein or muscle by a healthcare professional. The dosage will depend on your medical condition, the type of procedure you are undergoing, other medications you are taking, your age, weight, and how you respond to the treatment. If you are administering this medication at home, it's crucial to learn the proper preparation and usage instructions from your healthcare professional. Administering this medication too quickly into a vein can lead to serious side effects. Before using it, always check the product visually for any particles or changes in color. If you notice either of these, do not use the liquid. Make sure to also learn how to store and dispose of medical supplies safely. It's important to note that if midazolam 1 mg per milliliter injection solution is used for a long period of time, it may not be as effective. If this happens, discuss it with your doctor. While this medication is beneficial for many people, there is a risk of addiction. This risk may be higher for those with a substance use disorder. To lower the risk of addiction, it's essential to take this medication exactly as prescribed. If you have any concerns, be sure to ask your doctor or pharmacist for more details. Some common side effects of midazolam injection solution include pain or redness at the injection site, as well as dizziness. If these effects persist or worsen, it's important to notify your doctor or pharmacist. It's essential to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to contact your doctor immediately if you experience any serious side effects, such as changes in mental or mood, shaking, uncontrolled movements, or low blood pressure. Seek medical help right away if you experience slow or shallow breathing or seizures. While a severe allergic reaction to this drug is rare, it's important to seek medical help if you notice symptoms such as rash, itching or swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Remember that everyone's experience with medication is different, so it's important to stay in touch with your healthcare provider. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Injecting midazolam into a vein can cause severe breathing problems, especially if given too quickly or in high doses. It's important to use midazolam under close medical supervision. Infants, children, older adults, and weak patients are more sensitive to the effects of midazolam, so lower doses should be used for them. Additionally, if a patient is also taking other medications that cause drowsiness, lower doses of midazolam should be used. It's important to be cautious with midazolam, as it has a risk for abuse and addiction, which can lead to overdose and death. Using midazolam with alcohol or other drugs that cause drowsiness or breathing problems can also have very serious side effects, including death. It's important to use the smallest effective dose of midazolam for the shortest possible time, and to avoid taking it with certain other drugs. Suddenly stopping midazolam can cause serious withdrawal symptoms, so your doctor may need to slowly lower your dose. If you experience any withdrawal symptoms such as headaches, trouble sleeping, restlessness, hallucinations, depression, nausea, or seizures, it's important to seek medical help. Withdrawal symptoms can last for weeks to months, so it's important to be monitored closely by a medical professional. Before using midazolam, it's important to discuss any allergies with your doctor or pharmacist. This medication may contain inactive ingredients that can cause allergic reactions or other problems. It's also important to share your medical history with your doctor or pharmacist, especially if you have conditions such as glaucoma, heart failure, kidney disease, liver disease, breathing problems, or a personal or family history of substance use disorder. Midazolam may cause dizziness or drowsiness, and using alcohol or marijuana can intensify these effects. It's important to avoid driving, using machinery, or engaging in activities that require alertness until you can do so safely. It's also important to avoid alcoholic beverages and discuss marijuana use with your doctor. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to discuss the potential risks and benefits of using midazolam with your doctor. This medication can harm an unborn baby, and newborn babies of mothers who receive this medication late in pregnancy may experience symptoms such as slow/shallow breathing, non-stop crying, shaking, or trouble feeding. Additionally, midazolam passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of the potential interactions that midazolam 1 mg per milliliter injection solution may have with other medications. These interactions could affect how this medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug are conivaptan, HIV protease inhibitors, such as atazanavir, lonafarnib, ritonavir, sodium oxybate. The risk of serious side effects, such as slow/shallow breathing or severe drowsiness/dizziness, may increase if this medication is used with other products that may also cause drowsiness or breathing problems. It's important to inform your doctor or pharmacist if you are taking other products such as opioid pain or cough relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, or antihistamines. Additionally, it's crucial to check the labels on all your medicines, such as allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Be sure to ask your pharmacist about using those products safely. If someone has taken too much midazolam injection and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include confusion, slow reflexes, clumsiness, slow or shallow breathing, deep sleep, and coma. It is important not to share this medication with others, as it is against the law to do so. Medical tests, such as monitoring your breathing rate, blood pressure, and oxygen saturation, should be conducted while you are using this medication. It is important to consult your doctor for more details on how to properly monitor these aspects of your health. If you forget to take a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take extra medicine to make up for the missed dose. Make sure to check the product package for specific instructions on how to store this medication, or you can ask your pharmacist for guidance. It's important to keep all medications out of reach of children and pets to ensure their safety. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless you are specifically instructed to do so. Instead, make sure to properly discard the medication when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.